Welcome to the ultimate guide on spleen health. Your spleen is one of the most underrated organs in your body, yet it plays a crucial role in your immune system and blood health. Most people don't even know where their spleen is located, or what it does until something goes wrong. In this comprehensive video, we'll explore everything about the spleen, its functions, common diseases, diagnostic tests, treatment options, and how to maintain spleen health. Whether you're concerned about your spleen or simply want to understand this mysterious organ better, this is your complete guide. Let's dive in. What is the spleen? Your spleen is a fist-sized purple-colored organ located in the upper left side of your abdomen, just below your rib cage and behind your stomach. In adults, it's typically about 12 centimeters long and weighs approximately 150 to 200 grams. Despite its importance, you can actually live without your spleen, though you'll need to take extra precautions against infections. The amazing functions of your spleen. Immune system defense. The spleen is your body's largest lymphatic organ and acts as a blood filter. It produces white blood cells called lymphocytes that fight infections. The spleen contains special white blood cells that can destroy bacteria, dead tissue, and foreign substances. Blood filtration. Your spleen filters about 5% of your blood at any given time, removing old, damaged, or abnormal red blood cells. It's like a quality control center for your blood, ensuring only healthy cells remain in circulation. Blood storage. The spleen stores about 1/3 of your body's platelets and can release them when needed for blood clotting. It also stores red blood cells and can release them during emergencies like bleeding or high-altitude conditions. Antibody production. The spleen produces antibodies that help fight infections, particularly those caused by encapsulated bacteria like pneumococcus and meningococcus. Recycling iron. When the spleen breaks down old red blood cells, it salvages the iron and returns it to your bone marrow to make new red blood cells. This recycling process is crucial for maintaining healthy blood. Removal of microorganisms. The spleen filters out bacteria, viruses, and other pathogens from your bloodstream, acting as a frontline defense against blood-borne infections. Splenomegaly. An enlarged spleen is one of the most common spleen problems, where the organ swells beyond its normal size. Causes include viral infections such as mononucleosis and hepatitis, bacterial infections like endocarditis and syphilis, parasitic infections such as malaria and toxoplasmosis, liver diseases including cirrhosis and portal hypertension, blood cancers like leukemia, lymphoma, and myelofibrosis, hemolytic anemia, metabolic disorders such as Gaucher and Niemann-Pick disease, inflammatory diseases like rheumatoid arthritis and lupus, and blood clots in veins to or from the spleen. Symptoms can include pain or fullness in the upper left abdomen that may spread to the left shoulder, feeling full after eating a small amount, fatigue and weakness, frequent infections, easy bleeding or bruising, and anemia, though mild cases may have no symptoms. Complications can include a ruptured spleen, worsening anemia, increased infections, and increased bleeding. Ruptured spleen. A medical emergency where the spleen's capsule breaks, causing internal bleeding. Common causes include traumatic injury from car accidents, contact sports, or physical assault. Infectious mononucleosis, which can make the spleen fragile, and rupture of an already enlarged spleen from any cause. Symptoms are severe pain in the upper left abdomen, often radiating to the left shoulder, tenderness, dizziness, confusion, rapid heart rate, low blood pressure, blurred vision, and signs of shock such as pale, cold, clammy skin. Treatment usually requires immediate surgery, which may involve repair or complete removal of the spleen, splenectomy. Splenic infarction occurs when blood flow to part of the spleen is cut off, causing tissue death. Causes include blood clots from conditions like atrial fibrillation or endocarditis, sickle cell disease, blood clotting disorders, and atherosclerosis. Symptoms typically include sudden severe pain in the upper left abdomen, fever, nausea and vomiting, left shoulder pain, and chills. Hypersplenism is a condition where an overactive spleen removes too many blood cells, causing deficiencies. Results can include anemia, low red blood cells, leukopenia, low white blood cells, and thrombocytopenia, low platelets. Symptoms often include fatigue and weakness, frequent infections, easy bruising and bleeding, and an enlarged spleen. Splenic cysts are fluid-filled sacs in or on the spleen. Types include true congenital cysts present from birth, false post-traumatic cysts that follow injury or infection, and parasitic cysts, such as from echinococcus infection. They are usually asymptomatic, but can cause abdominal pain or a feeling of fullness if large, and are often discovered incidentally on imaging. Splenic abscess is a rare but serious collection of pus in the spleen. Causes include bacterial infections spreading through the bloodstream, trauma or infarction leading to secondary infection, endocarditis, and immune system disorders. Symptoms typically include fever and chills, left upper abdominal pain, nausea and vomiting, and left shoulder pain. Splenic tumors can be benign or malignant. Benign types include hemangiomas, blood vessel tumors, lymphangiomas, lymphatic vessel tumors, and hamartomas. Malignant tumors include rare primary angiosarcoma and secondary involvement from lymphoma, leukemia, or metastases from other cancers. These tumors are often asymptomatic until large, then may cause abdominal pain, spleen enlargement, or constitutional symptoms such as fever, weight loss, and night sweats. Asplenia means an absent or non-functioning spleen, either congenital or acquired after surgical removal. Risks include a dramatically increased risk of severe bacterial infections, particularly from encapsulated bacteria, risk of overwhelming post-splenectomy infection, OPSI, and a higher risk of blood clots. Accessory spleens are small extra spleens found in about 10 to 30% of people. They are usually harmless, typically pea-sized, may enlarge if the main spleen is removed, and can sometimes be mistaken for tumors on imaging. Wandering spleen is a rare condition where the spleen is not held in its normal position and can move around the abdomen due to weak or absent ligaments. It is more common in women and may be congenital or acquired. Risks include splenic torsion, where twisting cuts off blood supply and often requires surgical intervention. Palpation. Doctor feels for enlarged spleen below left rib cage. Normal spleen usually cannot be felt. Patient lies on right side or back. Doctor presses gently under left rib margin. Percussion, tapping on abdomen to estimate spleen size, helps detect splenomegaly. Blood tests, complete blood count, red blood cell count, normal men 4.7, 6.1 m, women 4.2, 5.4 m, hemoglobin, men 13.5, 17.5 GDL, women 12.0, 15.5 GDL, white blood cell count, 4,500, 11,000 cells, MCL. Platelet count, 150,000, 450,000 MCL. Peripheral blood smear, examines cell shapes, detects Howell-Jolly bodies, spherocytes, target cells. Liver function tests, AST, ALT, bilirubin, alkaline phosphatase, LDH, elevated in hemolysis lymphoma. Reticulocyte count indicates marrow response. Coagulation studies, PT, PTT, INR, blood cultures for infections, infectious disease tests, monospot, hepatitis panel, HIV, malaria smear, autoimmune markers and tumor markers as indicated. Imaging tests, ultrasound, first line, measures spleen size, normal up to 12 cm, detects cysts, masses, infarcts, Doppler for blood flow, CT scan, detailed anatomy, detects rupture, infarction, abscess, tumors, contrast shows enhancement, gold standard in trauma. MRI, superior soft tissue contrast, characterizes masses, detects iron overload. Nuclear medicine scans, technetium-99 mirror sulfur colloid, tagged RBC, show function and accessory spleens. PT scan detects metabolic activity for cancer staging. Chest and abdominal X-rays have limited but occasional value. Specialized procedures. Splenic biopsy is rarely performed due to bleeding risk. Options include fine needle aspiration, or needle biopsy under imaging guidance, or surgical biopsy during splenectomy. Bone marrow biopsy is used if blood cancer suspected. Endoscopy checks for esophageal varices indicating portal hypertension. Angiography may be used to show splenic vessel anatomy or identify aneurysms or malformations. When each test is used, for suspected enlarged spleen, CBC and ultrasound initially, then CT or MRI if unclear, plus blood smear and liver tests. For trauma, CT with contrast, gold standard, and fast ultrasound in ER with serial hemoglobin checks. For infection, blood cultures, CBC with differential, monospot or specific infectious tests, ultrasound or CT if abscess suspected. For cancer, CBC, blood smear, CT or PET, bone marrow biopsy, LDH and tumor markers. For blood disorders, CBC, red count, blood smear, hemolysis workup, genetic testing as indicated. For mild splenomegaly without symptoms, doctors often recommend observation with regular blood tests and imaging. Monitor for progression and treat the underlying cause. Activity restriction is important. Avoid contact sports, heavy lifting, and any activities with abdominal trauma risk to reduce rupture. For pain, acetaminophen is preferred, 325 to 1,000 mmol every 4 to 6 hours, max 4,000 mmol per day. Avoid NSAIDs like ibuprofen or aspirin if platelet counts are low because they increase bleeding risk. Prescription pain medicines may be used short-term, opioids reserved for severe pain. Splenic artery embolization is a minimally invasive procedure where an interventional radiologist inserts a catheter, usually via the groin, to block blood flow to part of the spleen. It reduces spleen size, treats hypersplenism, helps control bleeding, and can relieve partial infarction symptoms without full surgery. For splenic abscess, percutaneous catheter drainage under CT or ultrasound guidance plus prolonged IV antibiotics is standard. Radiofrequency ablation uses a heated probe to destroy small benign splenic tumors as a minimally invasive option. Splenectomy may be required for rupture, refractory hypersplenism, some blood disorders, large cysts or tumors, or abscess not responding to treatment. Open splenectomy uses a large incision with longer hospital stay. Laparoscopic uses small incisions and faster recovery. Partial splenectomy or splenic repair may preserve some function when possible. After splenectomy, immediate care focuses on pain control, early mobilization and breathing exercises, and close monitoring. Vaccinations are critical. Pneumococcal, PCV13 then PPSV23, meningococcal, MenACWY and MenB, Hub, plus annual influenza and COVID boosters, ideally before surgery or 2 weeks after. Antibiotic prophylaxis is recommended, daily for at least 2 years, lifelong for children immunocompromised, and carry emergency antibiotics at home. Wear medical alert identification and seek immediate care for fever over 100.4 degrees. Protecting your spleen. Wear seatbelts in vehicles. Use proper protective gear in contact sports. Avoid high-risk activities if the spleen is enlarged. Wear appropriate safety equipment during recreational activities. If you have splenomegaly, avoid contact sports completely. Football, rugby, hockey, martial arts. No activities with risk of abdominal impact. Avoid heavy lifting. Be cautious with coughing or straining. Follow up regularly with your doctor. Diet for spleen health. Focus on overall healthy eating. Plenty of fruits and vegetables, whole grains, lean proteins, healthy fats, and limit processed foods and added sugars. For liver disease with splenomegaly, low sodium diet, adequate but not excessive protein, avoid alcohol, small frequent meals. For blood disorders, iron-rich foods if anemic, avoid iron if iron overload, folate-rich foods, and vitamin B12 sources. Post-splenectomy, well-balanced diet to support immune system, adequate protein for healing, antioxidant-rich foods, consider probiotic-rich foods. Hydration, aim for about 8 to 10 glasses of water daily, more with exercise or heat. Exercise and physical activity. With a normal spleen, aim for 150 minutes of moderate exercise weekly. Mix cardio, strength, flexibility, and balance. With an enlarged spleen, consult your doctor and focus on low-impact activities like walking, gentle swimming, yoga, avoid inversions, and stationary cycling. Avoid contact sports, activities with fall risk, and exercises causing strain or jarring. Post-splenectomy, return to activity gradually after healing. Resume most activities but continue to avoid unnecessary injury risks. Preventing infections is crucial for splenic individuals. Practice good hygiene, frequent hand washing and hand sanitizer. Avoid close contact with sick people, and don't share utensils. Food safety, cook meat thoroughly, wash produce, avoid unpasteurized dairy, and store food properly. Wound care, clean cuts immediately, use antibiotic ointment, watch for infection, and seek care for deep cuts or animal bites. Dental health, regular checkups and good oral hygiene. Antibiotics may be recommended before procedures. Travel. Consult your doctor before international travel. Update vaccinations. Carry antibiotics. Get travel insurance. Avoid malaria areas or take prophylaxis, and be careful with food and water abroad. Stress management. Chronic stress weakens the immune system, so practice relaxation techniques like meditation and deep breathing. Get adequate sleep, 7 to 9 hours. Stay active and maintain social connections. Avoid toxins, limit or avoid alcohol, especially with liver disease, and don't smoke. Minimize exposure to environmental chemicals and use protective equipment at work when needed. Supplements. Consult your doctor before taking immune-boosting supplements, probiotics, vitamin D, or multivitamins. Avoid supplements that thin the blood if you have low platelets, and avoid unapproved herbal remedies. Regular medical care, get routine checkups, blood tests, and updated vaccinations. Know your baseline, spleen size, normal blood counts. Track symptoms and report changes to your doctor. Emergency situations. Call 911 or go to the ER immediately. Suspected ruptured spleen. Severe pain in the upper left abdomen after trauma. Pain radiating to the left shoulder. Dizziness, confusion, or fainting. Rapid heartbeat. Signs of shock such as pale, cold, clammy skin. Blurred vision. Signs of serious infection, especially after splenectomy. Fever over 100.4 degrees, 38 degrees C. Severe chills, rapid breathing or difficulty breathing, confusion or altered mental state. Severe headache with stiff neck, unusual rash, severe weakness, severe symptoms, sudden severe abdominal pain, chest pain or difficulty breathing, coughing up blood, vomiting blood or coffee ground material, black, tarry stools. Urgent situations. Contact your doctor same day. Fever over 100.4 or if you don't have a spleen. Persistent abdominal pain. New or worsening pain in the left upper abdomen. Unusual fatigue or weakness. Easy bruising or bleeding. Frequent infections. Feeling full after small amounts of food. Unexplained weight loss. Routine appointments needed. Persistent mild discomfort in the spleen area. Questions about spleen health. Need for vaccinations before splenectomy. Follow-up after splenectomy. Regular monitoring of known splenomegaly. Thousands of people live normal, healthy lives without a spleen. However, you'll need to take lifelong precautions. What changes? Increased infection risk, especially from encapsulated bacteria, a slightly higher risk of blood clots. You may have a small increase in platelet count. The immune system works differently, but still functions. What doesn't change? You can live a completely normal life with proper precautions. Normal life expectancy, ability to work, exercise, travel, no dietary restrictions, and you can have children. Adaptations and lifestyle. Maintain normal activities. Work and career usually not affected. You can participate in most sports, but avoid high-risk contact activities. Vigilance is key. Know the signs of infection, act quickly, keep medical information accessible, inform all healthcare providers, and educate family members. Wear a medical alert bracelet or necklace that states asplenic or no spleen, and carry emergency contacts and antibiotic information. Build a healthcare team. Primary care physician, hematologist if needed, infectious disease specialist as appropriate, plus regular dental care. For children, higher infection risk often require daily antibiotics until at least age 5 and additional vaccines. Inform schools and have emergency plans. Pregnancy after splenectomy is generally safe. Inform your obstetrician and continue precautions. Your spleen may be small, but it plays a mighty role in keeping you healthy. Understanding how it works, recognizing warning signs, and knowing how to protect it empowers you to maintain optimal spleen health. Key takeaways. The spleen is crucial for immune function and blood health. Many conditions can affect the spleen, from infections to cancer. Diagnostic tests, including blood work and imaging, can identify problems. Treatment ranges from observation to surgery depending on the condition. Living without a spleen is possible with proper precautions. Vaccinations and infection prevention are critical post-splenectomy. Seek immediate care for trauma, severe pain, or signs of serious infection. Remember, protect your spleen from injury. Seek prompt medical attention for concerning symptoms. If you don't have a spleen, vigilance against infection is lifelong. Regular medical care and vaccinations are essential. Millions of people live full, healthy lives without a spleen. Whether you're learning about your spleen for the first time, dealing with a spleen condition, or living without a spleen, knowledge is power. Stay informed, stay vigilant, and work closely with your healthcare team. If this comprehensive guide helped you understand spleen health better, please like this video and subscribe for more detailed health content.